Hello and welcome to Medical Dialogues. I am Dr. Nandita Mohan. Let's look at today's top medical news. Early pregnancy subclinical hypothyroidism linked to quadrupled risk of postpartum thyroid dysfunction. A new study has shown that subclinical hypothyroidism, diagnosed before 21 weeks of pregnancy, is associated with more than fourfold higher rates of overt hypothyroidism or thyroid replacement therapy within 5 years of delivery. The study is published in the peer-reviewed journal Thyroid, which is the official journal of the American Thyroid Association. Now, subclinical hypothyroidism, or a change in the levels of thyroid stimulating hormone that isn't severe enough to cause symptoms, is especially common during pregnancy, affecting as many as 1 in 4 pregnant people. Now, while subclinical hypothyroidism isn't inherently dangerous, overt hypothyroidism comes with serious symptoms including fatigue, depression, and even heart problems. Glycated hemoglobin A1c levels and dementia risk in older diabetics, a new perspective. Individuals with diabetes commonly experience Alzheimer's disease and related dementias, which is called as the ADRD. Now, factors such as hypoglycemia, hyperglycemia, and glycemic variability have been associated with increased risk of ADRD. Traditional glycemic measures such as the mean glycated hemoglobin A1c may not identify the dynamic and complex pathophysiological factors in the association between diabetes and ADRD. The HbA1c time in range is a previously developed measure of glycemic control that basically expresses the HbA1c stability over time within specific ranges. Now, this measure may inform the current understanding of the association between glucose levels over time and the ADRD incidence. Atypical type of macrophages enable alveolar regeneration following lung injury. We all know the lung is constantly exposed to airborne pathogens and particles that can cause alveolar damage. Hence, appropriate repair responses are definitely essential for gas exchange and life. Here, the authors deciphered the spatiotemporal trajectory and function of an atypical population of macrophages after lung injury. Post-influenza A virus infection, short-lived monocyte-derived Ly6G expressing macrophages were recruited to the alveoli of lung perilesional areas. The Ly6G plus max engulfed immune cells exhibited a high metabolic potential and clustered with alveolar type 2 epithelial cells in zones of active epithelial regeneration. The Ly6G plus max were partially dependent on granulocyte macrophage colony stimulating factor and interleukin 4 receptor signaling and were essential for the AT2 dependent alveolar regeneration. Study finds possible link between sleep issues, substance use, and suicidal thoughts in depressed adolescents. Sleep difficulties and misuse of drugs or alcohol have been associated with suicidal ideation, especially in younger population. Using cross-sectional representative surveys of adolescents, the researchers conducted adjusted logistic regression modeling to assess the relationships between sleep difficulties, substance use, and suicidal ideation among adolescents with a history of depression. Data were analyzed from 66,422 adolescents aged between 12 to 17 years. 38,418 participants responded out of this affirmatively to the mental illness screener. Among these, 11.6% reported thinking about suicide, 5.7% reported planning a suicide attempt, and 3.8% reported making a suicide attempt. 16.7% reported sleep difficulties even. Of the analytical sample, 2.8% reported alcohol abuse or even dependence, and 4.6% reported illicit drug dependence or abuse. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.